Oh, good. All right. Well, it appears we do not have quorum. My understanding from Crystal and Don is that there were some pretty bad storms in St. Paul and people are having home consequences or complications because of that. So, so we won't be able to do any voting on anything, but I really don't think we have anything that we have to vote on. Angela just popped up too. Okay. So we'll be kind of keeping an eye on whether or not maybe we do attain quorum, but we can still have a discussion and maybe updates. All right, so do you have roll call? Are you able to do roll call?
I can do roll call.
As we
as we
do
go.
a rolling
Yep.
roll call?
I will,
Okay.
yes.
All right. So who are the people? Do you know who the speakers are for the
yes.
Misty is first.
We've got Misty. Yep.
Okay.
And then Kelly will be second. Kelly Hatt.
Okay. Welcome, Misty and Kelly. They're going to be talking to us from the Office of Ombuds for Foster Care to kind of give us, provide some information around those issues. I assume that's related to some of the stuff we've talked about with juveniles in the system. So any announcements before I give the floor to Misty? Okay, well, hearing none, Misty, I'm going to turn the floor over to you. And thank you for being here.
Thank you. Good morning, everyone. I'm excited to be with your group today, and as noted, I plan to share information about our office, which is the Office of the Foster Youth Ombudsperson. We're known as OFI for short, and then hopefully hear some questions and input or responses or things from you all. I do have a presentation prepared, so I'm gonna
Okay.
hopefully try to share that here.
We're up to 10 people, so we're almost there.
Okay.
Can someone tell me if it's successfully shared? I think it's loading now.
I think it's, yeah, it's
Yep, you're good.
there it is.
Okay.
Yep.
Great. All right,
Yeah.
so I'm going to share a little bit about our office and how we were formed and some of the key aspects of what we do and some of the powers that we have, and then share with you some of the themes and trends that we're seeing within our agency with the complaints and concerns that come our way, and then talk about how you may consider connecting with us or helping us spread the word about who we are directly to foster youth. We always do like to start our presentations kind of sharing about ourselves and helping describe why we do this work and how we're grounded in this work. So I have an image here that's myself and my siblings and my grandmother from when we were in foster care. So I have lived experience as a foster. I use the term capital F foster, following the lead of our younger advocates to refer to those of us who have experienced foster care, no matter how or when we left. So I entered foster care when I was a preschooler with my 3 older siblings that are here in this picture. We were in Rochester and Olmsted County in Minnesota here. Ultimately, we never reunited home with our family, and we were adopted by non-relatives. This picture that I share here is from what was described to us as our goodbye visit with our grandmother Rose. Although my grandma Rose was never a subject of our child protection case and had never been a caregiver for us, it was clear from this visit and from those words that were used of describing it as our goodbye visit that when my parents' rights were terminated, we were expected to say goodbye to our entire family. So thankfully, my siblings and I stayed together, in foster care and into our adoption, but we experienced separation years later, and when 2 of them re-entered foster care. I also have siblings who have experienced specifically interactions with the juvenile justice system and incarceration. And so the work of your task force is one of the many things that are near and dear to my heart and I understand the impact of. So I share this just to kind of show that I have that deeply held and deeply understood expertise of how much responsibility and power that our child welfare and other systems hold. And I recognize that I'm in the position as the ombudsperson for foster youth to encourage responsibility and to encourage care with how that power is used. So beyond myself, we currently have 5 folks on our team at our small agency. We have 1 position that's open that we are hoping to fill soon as we're in the interviewing process. So besides myself, we have our deputy ombudsperson, Hannah, foster youth outreach and engagement specialist, Lexi. We have Robin, who is our intake program specialist, and Tanya, who is our investigator. As you can see, we have kind of indicated the folks on our team who have that lived experience as a foster. So again, that direct lived experience in foster care. So 3 out of the 5 of us currently on our team have that lived experience, which we think is helpful to have. We also have a diversity of experiences in terms of the work that we've done in child welfare, so ranging from public policy to direct youth work to child protection investigations and other direct kind of supports and services to foster youth. I think you, compared to some other groups that I talked to, maybe have a little bit more familiarity with the term ombudsperson, since you have representation from Lauren from Ombuds for Corrections, and I think maybe have had presentations from other ombuds roles. But we do like to start with this because I know sometimes even just the pronunciation of what an ombudsperson, how to say the word, can still be a little bit tricky. And then just at a high level, the role of an ombudsperson is someone who investigates complaints and concerns, typically makes reports about the complaints and concerns and the kind of outcome of their investigations, and generally helps settle requests for assistance in some way. So this is just here to kind of show you how we are situated in Minnesota with our fellow ombuds offices, and this isn't all of them, but some of them. So again, I think you have familiarity with the Ombuds, Office of Ombuds for Corrections, and then maybe have some familiarity with the Office of Ombudsman for Mental Health and Developmental Disabilities, or the Office of Ombudsperson for Families and Office of Ombudsperson for American Indian Families. We have the dates here of when those offices were established, and so just kind of showing us in comparison, we were officially established in 2023. That's when I started in my role to set up the agency and build the foundation of our agency, and we officially opened in May of 2024. So we've just hit our 2-year anniversary of being officially open and up and running and functioning to be able to receive complaints from and on behalf of foster youth, respond to those complaints, complete investigations when necessary, create and disseminate public reports, and provide recommendations to the legislature and to larger agencies like the Department of Children, Youth, and Families. This is a picture here of foster advocates on the day of the vote that was held at the legislature to officially create UFI. So we just like to highlight this, that really we were born from the voices of fosters and those in community who saw the need for an office specifically for foster youth, one that was dedicated to connecting with foster youth and upholding or centering their needs and experiences and their rights. For those of you who like this level of detail, this is some highlights of our statutory authority and the powers that we were given through the work at the legislature to be able to officially create our agency. So some of the things that we have the power to do is to investigate actions of agencies. So that is specifically the Department of Children, Youth, and Families, as well as county agencies and then child placing agencies. We can also investigate actions of foster home homes and facilities. We have the power to request and be given access to information that's necessary for us to be able to do our investigations and determine if there is validity to a complaint or a concern that comes our way. We can make recommendations to any of those agencies. So far we've made recommendations to the Department of Children, Youth, and Families, and then we make recommendations on a regular basis to local counties about specific cases and or about their specific practices. We've made recommendations to the legislature, and we have made some recommendations to judicial officers or judges regarding decisions that they've made and the cases that they're handling. We do have some language spelled out in our statute that we have essentially the expectation that we are to raise issues that might need statutory change, to raise those to the governor or the legislature. So we're not bound by only having to look at what is currently spelled out in statute or a policy and determining kind of the validity of a complaint based on that. If we're seeing something that largely is based in a gap in statute or something in statute that really is not best serving foster youth, then we are expected and have the power to raise those issues. And then we also have some pieces in our statute around the requirement that we do outreach and provide resources and assistance directly to foster youth. And so that's why we have positions on our team that are dedicated to doing that outreach and engagement with foster youth in facilities and in foster homes and in other settings. So far, what that's looked like is last year we did quite a big push and visited all of the psychiatric residential treatment facilities or PRTF facilities here in Minnesota. And some of those settings also have like associated foster homes or group homes. And so we presented to foster youth in all of those settings. And then we've presented at some foster youth shelters, or youth shelters that some of them have foster youth at. And then we've done a good number of individual youth visits and youth contact if we're not able to do in person for some reason for the investigative cases that we take on. We also did do an out-of-state visit, knowing that we have some of our Minnesota foster youth who end up being placed in out-of-state residential settings because of lack of options here. So last May, we went to Arkansas and visited 2 different facilities and were able to meet individually with a handful of Minnesota foster youth that were there at that time. And we hope to do some additional out-of-state visits later this summer or fall as well. And again, for those who appreciate this level of detail, we also included our statutory reference related to the classification of our data under Chapter 13. Largely, most of our data is considered private, and when we have an active investigation going on, that data is considered confidential and classified in that way. In the last year, we have worked with our advisory board to identify and define our agency values and how we focus our work. Our advisory board is composed of 15 different positions. 9 of those 15 are spelled out to be people with lived experience in foster care. So 5 of those are specifically for people who have been in foster care more recently. So kind of what that's been interpreted as is people under the age of 25. And then we have 4 roles for people who've been in foster care at any point in time and are of any age. And then we have a guardian ad litem, an attorney, and 3 roles for people who work at nonprofits that are serving foster youth. And there's one more, and I can't remember. A guardian ad litem, there we go, is the last one. So anyhow, we worked together between our staff and our advisory board to define these values, helping us prioritize our work, helping us make decisions about cases that we take on and how we operate. So I just wanted to at least give you the visual and share this here. And again, we have this centered in the experiences of fosters, using that term foster with a capital F to identify and refer to anyone who has experienced foster care, whether they were adopted or they aged out or they were reunified back with their family. Alrighty. This one is a slide from our data from our first year of operation. So that we considered from May of 2024 when we opened through June of 2025. So about a 14 month period. And so we've been pretty active from the start and people reaching out to us. During that time frame, we received 237 concerns, and you can see in the bottom left here kind of the composition of who we were hearing from. So for that first year, about 14% of the concerns and complaints that we heard were directly from fosters themselves. The largest group was relatives, and I would say that even without having the data for our year 2 yet available, that is still a pretty large group of people that we hear from. So relatives includes a foster youth parent, as well as any other type of relative, whether it's an older adult sibling or it's a grandparent or a cousin or an auntie. And then we hear from a wide variety of other people, professional supports of a foster youth, people on their foster care team. We've just heard from people in the community who are aware of a foster youth situation in some way and have a complaint or concern to share. And then we do have some that the complainant's identity was either anonymous or unknown. We do have something built in to our complaint submission system that people can submit an anonymous complaint either through the phone or online. We did that intentionally and trying to do it as thoughtfully as possible because, of course, when you have someone sharing information anonymously, you're limited in being able to follow up and having initial information. But we heard a lot, especially from the young people who were advocating for the creation of this office, about concerns about retaliation and bringing up concerns about their care or about how they're being treated by those on their team, and knowing that they would, when you're bringing up a concern about people who have a direct impact and kind of direct power and control over your full life experiences, we felt it was really important to make sure that we had an opportunity for people to submit anonymously. So we've had a small number of those and have been able to navigate follow up on those as best we can. All right, I'm getting into the parts now that maybe are of most interest. And so this is some of the overview of the types of requests, and then I have some more information about that in the next couple of slides as well. So this is kind of more so the things that come our way and the types of questions or concerns that we're hearing about. A lot of what we hear about is the services that a youth might be receiving or should be receiving, but they're not receiving. Sometimes that's things like access to extended foster care, which you may have some familiarity with in Minnesota. We have the availability of extended foster care for youth who are over the age of 18 and under the age of 21 to continue to receive some supports and services from the county or tribal social service agency that they had their case open with. And we see some challenges with youth being able to access that. Otherwise, generally, we see concerns about rights of a foster youth being ignored. Something we see there kind of a lot is things related to youth's basic needs. So seeing that youth are unfortunately often moved quite a bit and kind of moving from group home to foster home to residential facility to correctional types of placements, and their belongings not always moving along with them, and or just as they're growing. The number of times that we've talked with youth about an overview of their rights and they've told us that they don't have socks or underwear is honestly much, much higher than we expected. So that's where we see a lot of power in us being able to inform them about their rights to, basics and beyond of what they can expect while they're in foster care, and then for us to be able to raise that to the folks on their team and make sure that those types of things are being attended to. Otherwise, we hear concerns about living conditions and determine what's within our scope to address versus what might be best handled by licensing or other entities. On the top right, you can see we have the text box there, people sharing with us something about their experiences in the past. So we've had people reach out to us where their experience in foster care was 10 or 20 or sometimes 30 years ago. But they had, had such an impact on them in terms of a challenging experience that they at least wanted to share it, knowing that nothing can be done, about their situation to remedy it, but being heard is just incredibly powerful, and being validated of, what you're describing is not how foster care is intended to be. And I'm sorry that you had that experience. And then talking with them about options if they wanted to maybe share with the county that was involved with their case, even though it's been a while, of just still seeing if there's something that can be learned from that person's experience and how their case was handled and how it continues to impact them into adulthood. And then I've already kind of talked about anonymous complaints and noted that we're able to recommend changes to law related to foster care. And sometimes people are reaching out to us specifically kind of with ideas around that or requests for that. I've touched on some of these things. Another theme that we see is about the inclusion of youth input. So input into their case planning while they're in foster care, input into their independent living planning, especially for youth who are over the age of 14, getting closer to adulthood and needing a lot of support to be ready for that. As we know, there's tons of layers to being an adult and tons of things that are needed for that. And making sure that the young person themselves is guiding that and leading that in terms of what they want their life to be like and what supports and services they need to have that happen. So on this slide here, a couple of trends and themes that I wanted to share, but also you can see there's a QR code, and that one takes you directly to the page on our agency website that includes our investigative reports. So I think at this point we have a handful of individual investigative reports for cases that we've done an investigation of and determined that the practices and decisions that we were seeing for that specific foster youth case was something that was helpful for there to be public awareness of, and to and we intentionally decided to make the report public, as opposed to just sharing our findings and recommendations with the agency and kind of following up with them in that way. So when we publish a report, we go through a process of typically many meetings with the involved agency in trying to better understand the situation, sharing our observations of what we see that might be stepping outside of expected policy or practice. And then when we write the written report, they have the opportunity to do a written response, and that is published with our report on our website. So if you're curious to see more details of the types of things that we're seeing, you can take a look at that page in our investigative reports. We've also done one systemic or issue report at this point, and so that was related to the lacking support for sibling relationships. So over our first year of being open, this kept cropping up consistently. Sometimes it was the basis of the complaint or concern that people were reaching out to us about, and lots of other times people were contacting us about something totally different. And then as we were reviewing the case, we could see, oh, this foster youth has a sibling or multiple siblings, and it doesn't look like they've gotten the required notification that they're supposed to get about their rights. We have a specific sibling bill of rights for foster youth that was passed in 2018, again, from those with lived expertise kind of leading those efforts. And so unfortunately, we saw that the implementation of the sibling bill of rights really was lacking, and that many counties, most counties, didn't have a built out policy or practice for how they were providing that notification to foster youth, or providing notification to their adult siblings and to the others who needed to get that information. And then that there was some challenges in the efforts being made by counties to protect and support those sibling relationships. So we have an issue report that outlines that and the recommendations that we made. Thankfully, this is one of those that we can see some really concrete action that was taken. So as a result of our report, DCYF did update their materials related to the Sibling Bill of Rights. So they made a more youth-friendly version of the notification that's to be given to foster youth to help them understand what their rights are related to protection of their sibling relationships. And DCYF also released more specific guidance and instructions for caseworkers about what their role is in providing the Sibling Bill of Rights and supporting all of the things that go along with the Sibling Bill of Rights and the documentation of it and things like that. So that's a big one that we saw. I saw a question in the chat related to maybe the third bullet point here about what 260D voluntary foster care for treatment is. So youth can enter foster care through a few different paths. I think typically what most people are familiar with is youth who end up being placed out of home in foster care because of a child protection concern and because of concern about their safety and remaining at home with one or both parents or guardians or whoever was in charge of their care. And so it's typically for the focus of having parents work on the challenges that led to the child needing to be placed out of home. So whether that's substance use or mental health or other types of things, you know, their parenting skills and things like that. So that's, I think, the primary pathway, or I know that is the primary pathway that youth enter foster care. 260D is a different pathway that youth enter foster care, and that is specifically for the purposes of accessing mental health treatment. So it's a voluntary pathway that parents can reach out and ask for support from their county agency when they are trying to access kind of higher level of mental health services and or placement in foster homes, specifically based on the mental health needs of their child. Minnesota, I think, is unique in this regard in having this pathway. And we, as noted here, see a lot of confusion with how it's implemented and enacted and some inconsistencies across counties. So that's something that has come to our attention as well. I'm gonna just touch on a couple of other things and then open it up to see additional questions that are coming to mind since I've talked quite a bit at this point. Another piece here is the second bullet point. We've seen lots of concerns about the use of crisis respite hotels and youth being placed in other settings that we would consider inappropriate and sometimes unsafe based on the youth's needs and what we're seeing in those settings. Crisis respite hotels was one that was really prominent in terms of our level of concern in seeing what that was like for youth in those settings. As you can see, you know, just the basis of the name, crisis respite is meant to be short-term rather than a long-term placement, but we've seen youth who've been in those settings for weeks and months or sometimes, you know, the better part of a year living in a hotel with staff and lots of challenges in what that equates to in terms of their access to healthy food and their access to normal experiences and things like that. In this same category now, there has been some changes made in terms of how often the crisis respite in a hotel setting is able to be used and how that can be used with current funding and health insurance. And so now we're seeing more of a rise of more young people being stuck social boarding in emergency departments. And so again, spending weeks or months, sometimes longer periods of time in the emergency department. So if you think about that, when you're in the emergency department, you don't go outside. You have limitations on people being able to come and connect with you. We see quite a bit of, you know, restrictions of people under the age of 18 going to go and visit young people in the hospital. So that limits a lot of contact with siblings. Just as you can understand, a complete lack of normalcy when you essentially live in an emergency department. So that's one of the challenges that's creeping up for us. We also see examples of young people being placed in correctional settings inappropriately when there isn't something that warrants them being there. Excuse me, simply again because of a lack of options otherwise for them to be placed in. And then examples of young people being placed in out-of-state settings. Excuse me. There we go. And then when they're placed in out-of-state facilities, we've seen concerns about how often they're visited by their caseworkers and kind of the lack of oversight and lack of attention being paid to their situations. So I'm going to pause there, see what questions come up for folks, things that I can expand on. Doing a little time check here. I have a couple of other things that I'll share, but otherwise wanted to see what's coming up.
Linda,
I see a
then
couple people
Angela?
raise their hand.
I do. Thank you very much. So from a county level, oh, too bad. I was looking at the PowerPoint. Okay. So the idea of crisis and treatment. So we have had young people in the emergency room for, well, the one I knew about personally was 3 weeks, and 3 weeks at about $3,000 a day for emergency room, and only because the child was on a hold and there was no place for the child to go, is bottom line. So I think I hear from counties that more and more this is the problem they're running into, is that there's not another place for the juvenile to go.
Yes, that's exactly what we're hearing and seeing more of. One of our investigative reports, we had highlighted specifically a young person's situation where they had been in an extended stay in a hotel setting and then kind of bouncing back and forth into emergency department stays, because typically you're not your best self when you're in those types of settings, and then the crises end up kind of cycling. And so thankfully, I do think that our report, in addition to probably county workers and others raising these concerns, I think has helped bring more attention to this of like, we need a solution. I do think that one of the impacts of that is that then now we have this decreased use of the crisis hotel respite, which is good in some regard. And then there's the negative unintended consequences of like, it was filling a need, and now where do those young people go? And again, I think that's where we're going to see more youth in these emergency departments. I know there's work being done led by the Children's Cabinet, the Governor's Children's Cabinet, to lead some interagency work around the larger root issue of this, and that's the lack of a effective continuum of care. Because if we had all the types of supports and placements and options that were needed, then we wouldn't be doing any of this. We wouldn't be doing emergency departments or hotels or putting kids in juvenile detention that shouldn't be there. And so that starts with, we need better in-home support. So we need better, on all ends of the spectrum of the levels of care that young people need. And so that's obviously a longer term project, and I'm hopeful that that will lead to some improvements, but we've also continued to raise of like, but what about now? It's one of those, I don't have a solution for you, because it is just a complete lack of options. So when we see situations like that, we're raising questions of like, is there a relative that if they got the right supports and services, they could be an option for the young person? Asking questions about the decision making in terms of what types of assessments have been done. Is it truly warranted that they need this level of care? Is the information about the youth accurate? So if they've been denied from group homes or denied from lesser restrictive settings, is that appropriate? Or, is that something that they that could meet their needs? But there's a whole bunch of these situations where it's really, really concerning, and the issue is, again, we just have a lack of options.
Right. So is this something that your office advocates for at the state level? Is there something that counties can do to help you if you do? Because we're doing it on our own. I mean, going up and advocating. Mostly it is about the ripple effect of for a child staying in an emergency room for like 3 weeks when all they're safe. That's about the best thing you can say for it, but they're not getting any help whatsoever. And then the cost to counties is astronomical.
Mm-hmm. Yeah. This is a hard one. Because I think, again, it's continuing to happen more and more. And it's not like there's the easy answer of here's this a better option, put them there. So what we've done is, again, trying to raise it to those who might be able to more specifically influence the situation, or sometimes it's that the young person maybe has an identified placement, you know, it's like a single site type of group home setting that's been developed specifically for them, but there's all these different pieces of the puzzle that needs to happen before they can actually leave the hotel or leave the emergency department to go there, in terms of licensing, and then this entity at the state needs to talk to this entity at the state, or maybe if they knew, they would have just, there would have been some expediting of like, there's a kid literally living in an emergency department, but if you can just do your part of the piece, that will move it faster so that they can get to this place that is going to provide them some more stability. So those are the types of things that we keep trying to figure out, like what is missing here and how can we, when these kids are at that point of crisis in the emergency department, what needs to be done to get them out and into a more stable setting as quickly as possible. And then we are looking at it specifically from that lens of foster youth rights. And so what can be done to increase their connection to family? How do we make sure that they've got, you know, normalcy types of experiences, even in the limitations in the emergency department in terms of access to comfort items and people that are visiting them and paying attention to them, and county workers who are, you know, in what we're looking at is the county acting within their role to be doing everything they can to get this youth somewhere else as quickly as possible. Or sometimes we see examples of lack of activity or lack of attention and oversight from county workers. So those are the types of things that we're trying to influence. But it's a huge issue. So as you say, you know, advocacy, there's lots that needs to happen, I think, to really address this and make change in terms of legislative changes and changes with just a lot of it is development of more placement options, whether that's foster homes or group homes or higher level settings that get these kids out of emergency departments. So this is not unique to foster youth, but we do see, I think, foster youth experiencing this more often than non-foster youth because of the dynamics of their care being handled by a county worker who has 10 to 15 or 20 cases on their caseload, and these are really complex. So I think they end up being stuck longer than maybe a non-foster youth might.
Angela?
I wish I had more of an answer for you, Linda. This is one of the biggest, we just literally on a daily basis get these cases flagged to us, and we're trying to figure out what we can do and who to flag it to. And I think we're getting more familiarity with that, but it's really, really hard.
Angela, go ahead.
Thank you. Thank you so much for the presentation. I'm wondering if you could just speak to how the process, having youth go out of the state of Minnesota, how that is decided, how those placements are decided, what percentage of our youth are going out of state, and then once they are out of state, who has jurisdictional oversight over those youth?
Yeah. So in terms of the process for youth going out of state, there is requirements through what's called ICPC, so the Interstate Compact on the Placement of Children. So there's oversight there from the ICPC team at the Department of Children, Youth, and Families that is aware of any youth who's being placed out of state for any reason. So sometimes youth are placed out of state because they have a relative identified, and they're going there because that's, you know, going to provide them the most familiarity and normalcy. But then we have this other subgroup of young people who are simply going out of state because we don't have the options and the resources and facilities to meet their needs here. So there's the oversight from ICPC. There is still the expectation that their case is still a Minnesota case, right? The court case that originated here in Minnesota, that continues, and there's still the same types of expectations for court oversight and county worker involvement or tribal social service agency involvement, the guardian ad litem, you know, all of the folks that are involved, if they were here in Minnesota, are still supposed to be involved in the same way. There's still supposed to be the same expectations for at least a monthly in-person caseworker visit. That's the state and federal requirement for any youth in foster care. And that's where we were seeing some challenges of youth being sent out of state and then sometimes going months without having an in-person caseworker visit. We do see that in terms of the guardian ad litem oversight in their role, they don't have the capacity from what we've heard to be able to go and see these youth out of state. So there is less eyes on them already in that regard. And then for youth who are 10 and older, they have the right to an attorney that's specific to them. And I don't think I've heard of any youth attorneys that are going to see youth out of state unless it's maybe in a neighboring state like Wisconsin, where it's close and accessible. Can you share more of what your question was so I can see if I can make sure I touch on the points as best as I can?
Yeah, it's sort of a segue to what Linda was mentioning about, children end up being roomed and placed sort of in because of lack of resources and where they can go outside of places like the emergency department or a hotel. Is there a risk of them being placed out of state in maybe an area where they're not going to get that oversight? That's just my question. If there's any way to even address it, I know it's a very complex issue.
Yeah. So I think the short answer to your question is yes. There's concerns with that. We have concerns the lack of oversight. I still would say that even if they are getting their monthly caseworker visit, that's so short. To see someone that you're familiar with, even just in their professional role for a few hours, maybe a month, is so limited. And so I think the ideal would be that when we're placing young people out of state, we should be seeing them more often, and there should be more attention and hands-on, eyes-on connection with them. And I think that, you asked something else that I was going to say something about. So yes, it's a problem. Some things that other states have done. There are some states who have prohibited out-of-state placement because they had such a concern of the high numbers of their young people, whether they were in foster care or more broadly, being sent out of state placement. So that's some approaches that other states have taken, is just outlawing it and not letting it happen. And so I think that puts some pressure on then having to develop more options within your state and more creativity to make sure that youth are staying in their state. Minnesota hasn't done that. So it's just the same expectations of the monthly in-person caseworker visits and doing all of the work beforehand to try and determine, is there an option here in our state before, jumping to that big decision of having a youth go out of state. And then when they're sent to an out-of-state facility, of course, these are short-term. There still needs to be an option for where they return to. And so I think we see young people staying out of state longer because there's still that same issue of a lack of an option. That's why they went out of state. We see that kind of continuing when their care has been determined to be, completed, or sometimes when they're terminated because of some major issue, continued behavioral challenge or something, where the facility is saying, we can't, we can't manage them here. So they need to go somewhere else.
Okay. All right. Thank you.
Misty, have you, in your experience, have you noticed any gender differences in the types of complaints or concerns that youth have? And I'm specifically interested in girls and gender nonconforming folks.
That's a good question. We are doing some tracking in terms of the complaints that we serve, with the demographics, and something that we're going to continue to pay more attention to see if we're seeing trends and themes, whether it's related to gender or race or sexual orientation, disability, any of those things, or if we're seeing, more and more cases from a certain region of the state, for example. Right now, besides knowing that we definitely hear more cases regarding young people who are Black or Indigenous or otherwise a person of color, I don't think we are seeing something that would be evident in terms of we're seeing many more girls or gender nonconforming youth or male youth at this time.
Okay. Go ahead.
I don't have a question, Misty. I just wanted to say how glad I am that your office exists now. And that I'm really grateful that you are in the position that you're in. Because I think the care and the thoughtfulness with which like you're leading this work was so clear, and everything that you shared with us this morning. So I just wanted to say thank you for what you do, and that I hope you and your team have good support systems in place for you too, because this is heavy and important work.
Yes.
Thank you. I really appreciate that. And I think we've got good systems and they're tested all the time. So definitely important there. I know I'm probably either at time or a little bit over time. I'm just going to go back if I can and share, because I think it's kind of a nice segue in terms of like how to connect with us or how you can help us with our outreach. So I wanted to just highlight, hopefully you could see it now, about resources of ours that you can share. So we have another QR code here that takes you to, I think this QR code takes you to our link tree, where you can see we've got some videos that we made that are specifically geared towards helping young people understand overview of foster youth rights, who in the heck is UFI, and like why would I call them, and what might they do if they call me, if I call them, and how they handle my complaint. And then we have two videos that are profiles of fosters on our advisory board, and them sharing a little bit about their personal experience, and again connecting to how UFI might be a resource. So those are all 2 minutes, 2.5 minutes, kind of short videos. So depending on what your role is, if you have a way to share this out with young people, we appreciate you doing that. On the left here, we have our kind of one pager about who UFI is, and again, how we might become, or how we might handle a case. With that one pager, you can see it is fairly text heavy. We were really focused on wanting to provide more information to foster youth on what they can do, and empowering them to be able to advocate for themselves whenever possible, and then with our support. So we have a clear section of what they can do if they don't feel comfortable or don't have the ability to, address an issue directly with their county worker or the people involved, or they've tried to do that and need that additional help and support of an office like ours. So we have that available as a resource that we appreciate, again, depending on what your role is, that you share that out with young people or people who maybe would be able to connect with young people and share that out.
Yeah, thank you, Misty.
Yeah,
This has been a really great presentation, and really helpful. Lots of great information, and I really admire the intentionality that your office puts in hiring people with experience. I think that's so important.
Thank you. Appreciate that.
So Kelly is going to present next, I guess.
Yeah.
Thank you, everyone.
The floor is yours.
All right, let's get this going. Hold on here. All right, we seeing it?
We see it.
Perfect. Thank you. Okay, good morning, everyone. My name is Kelly Haff. I'm the Legislative Director for the Minnesota Department of Corrections. Thank you for having me here today. Today, I'm here to provide an overview of the 2026 Minnesota legislative session and what it means for the Department of Corrections specifically and the state. So let's see if this will work. Move forward. There we go. Going into the 2026 session, there were many undercurrents that shaped the legislative environment. First, it was a very short session. Even numbered years are by nature shorter than odd number years in Minnesota at the legislature, because the legislature is not required to plan and pass a state budget. However, this session felt especially fast. It was roughly 3 months and included 2 week-long breaks, which meant the time frame to accomplish anything was very limited. Secondly, the political composition of the body required a strong focus on bipartisanship. The House was split, as it was last year, 67 Republican members and 67 DFL members, and the Senate had a narrow 1-seat DFL majority. Any legislation that was going to pass needed to be bipartisan in order to be successful. In good news, the state's budget outlook had significantly improved from the previous years. Previous year rather. In 2025, there was a concern about the projected $6 billion state budget deficit. But by the time we entered the 2026 legislative session, the outlook had greatly improved with a $3.7 billion surplus for the fiscal years 26-27, and then a little under $400 million for FY 28-29. This meant that proposals with any fiscal impact, any budgetary impact, needed to rely heavily on one-time spending and avoid creating ongoing costs in the out years, what we called the tails. And another important factor is that 2026 is an election year. Election dynamics are always strongly felt at the Capitol, and this year was no exception. The House, all House seats, all Senate seats, and the governor's office are up for re-election this year, as are, or election, I should say, as our Attorney General and Secretary of State's office. Several individuals from both the House and the Senate are running for statewide office, including Speaker of the House, Lisa Dameth, was running for governor, is still running for governor, which added another layer to political tension. As we entered the 2026 session, there was also a need to recognize the horrors and what I would describe as the traumas of Minnesota that occurred since the last session. This includes the June 14th murders of former Speaker Melissa Hortman, her husband Mark Hortman, and their dog Gilbert, as well as the attempted assassinations of Senator Hoffman and other DFL officials. Minnesota also experienced the Annunciation school shooting over the summer, and more recently, the presence of ICE in Minnesota, which led to the murders of Renee Good and Alex Preddy. All of these events occurred between the 2025 and the 2026 legislative session, deeply impacted the state, and influenced the priorities of both caucuses brought forward during this session. Bills that honored the individuals impacted by these tragedies or addressed related party priorities were given early attention. This included proposals related to immigration, gun control, and public safety related issues. On the Republican priority side, fraud was also a major focus. Fraud had become a central topic of conversation, is still a central topic of conversation, particularly in connection to the Feeding Our Future scandal and the DHS grant programs. Additional Republican priorities included tax relief and car tab fee relief. And if that wasn't enough, there was significant concerns about the Hennepin County Medical Center, which was facing bankruptcy and closing its doors for good. As is typical in even-numbered years, capital investment or bonding is also a major focus. These years are often referred to as bonding years in Minnesota, with an emphasis on addressing infrastructure needs across the state. Odd-number years tend to focus on the state budget. Even-number years historically prioritize bonding and capital investments. However, it hasn't been typical for the last 5 or so years since the pandemic, really. And it's an even number year, which meant that technically nothing had to pass. In odd number years, they have to pass a state budget in order to avoid government shutdown. However, in even number years, they don't have to pass a budget, a bonding bill, or even a single policy. Lawmakers can simply convene, complete their session, and adjourn without passing anything. All of this context contributed to a politically tense session from the very beginning. Committees took turns hearing political priorities and checking political boxes, even when those bills were unlikely to pass through both bodies. Some were seemingly to generate headlines, as much as, party positions on some issues. Some examples of this include banning face coverings for ICE agents, and even an article of impeachment against Governor Walz. At the same time, Minnesota was also receiving national attention. Federal officials requested Minnesota state leaders and lawmakers testify in Washington, D.C. on multiple occasions. These hearings focused on ICE activity, fraud, and more. On the picture on the right, you can see House Republican leader Harry Niska, Attorney General Keith Ellison, and DOC Commissioner Paul Schnell, who traveled to the Capitol, to DC, to testify in front of the U.S. Senate Homeland Security Committee and answer questions related to ICE activity and compliance. Another dynamic that shaped the session is what is called hold the line sentiment. In 2022, some of you who were politically involved in 2022 might remember that there was a $19 billion surplus, and the Republicans believed they were positioned to win a GOP trifecta. Gubernatorial candidate Scott Jensen tweeted "hold the line" as direction to Republicans, with the message that why would we compromise on bills in 2022 when we could win a trifecta and then spend it however we want. So there was fear amongst insiders and lobbyists that DFLers or GOPers would just wait until the election, hold the line, and not pass anything this session. Because of these factors, the session seemed doomed from the start. To add another layer of attention, there were ethics investigations involving 3 House members mid-session, 2 involving a drunk driving incident, and another involving lobbyist affiliations. All 3 ethics complaints were ultimately voted down, but the complaints themselves added some extra tension to the atmosphere. But despite all of that, in the end, the governor and legislative leaders announced compromise and global agreement just 4 days before the end of session. The final agreement included several significant provisions. Lawmakers agreed to keep HCMC afloat with a $205 million one-time fund directly to the hospital, preventing its doors from closing. In addition, they created a broader funding pool to support other hospitals in the future, including HCMC is able to apply for those funds in the future. They also reached an agreement on a $1.24 billion bonding bill, 1-year car tab fee relief, property tax relief for approximately 600,000 Minnesotans. The final agreement also included Capitol security package aimed at making the Capitol safer, including additional officers and enhanced metal detection systems. Lawmakers also agreed to the Office of an Inspector General, created a statewide office to focus on fraud prevention and agency oversight. In addition, the Attorney General's fraud unit received additional funding to expand its work. Perhaps most impressively, not only did they reach agreement, but they were able to pass all of these measures on time. There was no need for a special session. The legislature completed its work in those 4 days with just 13 minutes left to spare before the constitutional midnight deadline on May 17th. I truly believe that the spirit of honoring former Speaker Melissa Hortman helped the session to conclude in a meaningful and constructive conclusion. The energy of compromise and the commitment to doing what was best for Minnesota are the values that she believed in. And in many ways, I think remembering her and the messages she stood for helped guide them towards an agreement. Each side achieved some of their priorities. Each side gave up some of what they wanted in the spirit of coming to an agreement and getting stuff done for what's best for Minnesota. Given how difficult and divided the session was, I was impressed that they concluded on time. Of course, not everything they wanted passed. Like I said, there was no gun control measures ultimately passed, and several committees were unable to reach agreement on their budget bills, but still overall an impressive finish at the Capitol. So what does it mean for the DOC? This year, the Department of Corrections did not have a budget request, a supplemental budget request, which is the first time since I've been here in 2023 that we did not have one. We weren't directly involved in budget discussions. However, we had several important budget neutral policy priorities that we were able to get passed. I'll discuss the ones that were passed and will become law. The first was an expansion of our mental health unit authority. This will allow the DOC to use mental health unit beds at the Oak Park Heights prison facility for the evaluation and stabilization of incarcerated individuals. Prior to this change, those beds could be used only in very limited circumstance. If an incarcerated person had been identified as needing mental health treatment recommended for the unit, they had to volunteer to be transferred there. This means they had to be in a mental state where they could consent to volunteer and then still need that treatment, which was a small group of people. And then the other small group of people are individuals who were placed there on judicial commitment, awaiting transfer to more appropriate placement, such as Department of Direct Care and Treatment or Department of Human Services beds. Because of those limitations, these beds had the resources, but were often left open. So we were able to change it to allow for these short-term placements and broaden that authorization, which will be great for our general population. This law, the bill also allowed us to update statutes so that there can be more than one mental health unit in our facilities. Right now, it only says Oak Park Heights, but come August 1st, it will allow for MHU beds to be created in other facilities, including the possibility of doing so at Shockley, the women's facility. The second policy priority I'll talk about is the substance use disorder treatment change. Previously, the statute governing DOC substance use disorder treatment provided that only residential treatment was offered to only adults. We were able to change that and broaden that to say we do outpatient and intensive outpatient treatments for adults and also for juveniles. This change will also support our 1115 Medicaid demonstration waiver work. And now that those services are in statute, DOC is better positioned to bill Medicaid for those services. And the third priority on this slide is the Community Supervision Working Group. The Community Supervision Statute passed in 2023 was an overhaul of that section of statute and is imperfect and unclear in several areas, particularly when transferring between counties and DOC. And the staffing issues arose for the DOC when those transitions to CSAC, Community Supervision
An advisory committee.
Thank you. Too many acronyms. When community supervision would transfer between counties and the DOC. I'll just put it that way. So this group is going to meet and come up with recommendations for the next legislative session to how to provide clarity in that section of statutes. And lastly, the DOC proposed the Licensing Improvement and Simplification Act, which I affectionately refer to as LISA. This bill is a practical and overdue update to the correctional licensing framework for juvenile facilities and halfway houses. In 2021, the legislature passed the Hardell-Sherrill Act. The law created a graduated licensing tool for DOC to use with local adult and correctional facilities. These tools allow DOC to issue conditional license, require corrective action, and monitor a facility's progress towards compliance rather than immediately remove a license from a facility. The law also creates a clear and fair appeal process. However, those tools do not also apply to the juvenile facilities or halfway houses. Instead, those facilities were in that all or nothing licensing system. A conditional license allows a facility to remain open while correcting those deficiencies, and it promotes stability for the youth, residents, and staff, but it still ensures that the facilities are held accountable for making necessary changes. LISA extends the same licensing tools for jail licensing onto those types of facilities, in doing so, creating greater consistency across the state. The bill also addressed structural issues in 241.021, the licensing statute, which had been updated more than 41 times since it was created and became just a hodgepodge collection of different confusing statutes and requirements. So we removed anything that wasn't applicable to jails out of that statute into more appropriate sections of statute and created a separate statute for juvenile licensed facilities and for halfway houses, respectively. Lisa also addressed a juvenile separation issue. So we worked collaboratively with the Minnesota Juvenile Detentions Association on this bill, and they stated that in Rule 2960, which governs licensed juvenile facilities, that the reporting of juvenile separation events, whether administrative or health related to the DOC, was in a very short time frame, I believe 24 hours. And we have been directed to do rulemaking to extend that. I think the recommendation is to 7 days. And we believe that that is a reasonable time frame to ensure that we are receiving the necessary reports. And finally, like I said, it removes unnecessary provisions. It just cleans up that section of statute, updates language, adds definitions, just makes it a easier section of statute to understand. There were also several other policy provisions passed that were not DOC-led, but touched the work of the DOC. First was CODPA, the Correctional Officer Discipline Procedures Act. This legislation modifies correctional officer discipline procedures by incorporating those that are already applied to police officers, or peace officers rather. Another relevant provision was in the Probation Officer Retirement Plan, which is part of a broader pensions package. Under this change, the normal retirement age for probation officers in the community becomes 60 years old. The legislature also passed MNCOR related provisions, part of Representative Robbins' bill, to establish an additional transparency and cost accounting requirements for MNCOR. Many of these requirements DOC was already doing, and incorporate recommendations from the Office of the Legislative Auditor's report that was published last year. The bill also places a cap on incarcerated worker positions in private contracts. Another provision included restitution requirements under Minnesota Rehabilitation and Reinvestment Act, or MRRA, specifically the changes that supervision abatement. There has to be a consideration of non-payment of restitution when determining eligibility for supervision abatement, to the extent that the community supervision officer is aware. So individuals who willfully fail to pay the restitution will not be eligible for supervision abatement. Lastly, the legislature made changes to the Larry R. Hill Act, passed in 2025, which addressed medication access for individuals incarcerated in jails. The original law was intended to allow jails or individuals incarcerated in jails to include taking their prescriptions that they had been using in the community at the time of incarceration. However, jails identified implementation challenges with this section of statute, and the DOC was able to provide some helpful feedback along with the Sheriff's Association and community stakeholders to ensure that individuals the jail makes reasonable effort to contact medical providers who provide the prescription before changing or taking off a prescription from a person's medical record. And as I mentioned earlier, the state passed a bonding bill. This included major investment into the DOC, $41.51 million for asset preservation. The DOC has nearly a $1 billion asset preservation needs across our enterprise. So this is a helpful contribution and will prevent that number from increasing. The bill included $10.71 million to renovate the Dakota building in Faribault. That's a minimum security unit at the facility that has substantial infrastructure needs that you can see on that bottom picture there. The House and Senate Capital Investment Committees toured there over the winter and saw the dog training program, which is the other picture up there, that is located in that unit. And lastly, the bonding bill included $350,000 for facility consolidation and expansion pre-design. So the purpose of this funding is to study options for increasing the number of specialty beds or beds in general, for expanding space and programming space at facilities where the existing square footage may allow for that work, such as Faribault or Rush City. This pre-design will help. This pre-design will help the DOC evaluate future potential bonding requests. And looking ahead to the 2027 legislative session, which we are already starting to plan, the election is going to have a huge impact, of course. Every seat is up for election. Remember to vote. 43 out of 201 legislators are not running for re-election. So at least a fifth of the body will be brand new. Next year is a budget year, and there will be potentially limited financial resources. Like I said, only projected right now as $400 million, where inflation is putting pressures on every agency and everyone in the state, really. There will be a new governor. Governor Walz is not running again, so there will be a new governor with new appointees and new priorities, which will shape the landscape. And the 2027 legislative session starts on January 12th. And so we're counting down the days to the next session. So that's all I had for you today. Oops. Here is my email if you have any specific questions that you don't want to ask right now, but I'd be happy to take any questions you have now.
Linda, you have a question or comment?
I do. Thank you very much, Kelly. If you could go back to the question in regarding prescription medication in jails. One of the things that I really hear from counties is somebody would come into the jail and they might have a very specific medication. It might be a very expensive medication. And the smaller counties really struggle with that. There's no two ways about it. So I can't speak for all other counties, but in our county, we do have medical personnel. But they, at least up until the last time I talked to them, they might go for a more generic medication. So you cut out the mic cut out a little bit when you were talking about that, but could you go back and address that from a county jail perspective, the idea of going from a certain prescription med, but it's very expensive, to probably rapidly to something that's more generic?
Sure. So that is part of the implementation problem from the 2025 version of the bill. So in 2025, the law said you must keep that person on the same medication unless you talk to their provider and the provider says that you can change it. And the counties and the Sheriff's Association voiced their concerns after they saw it become law. That was part of the debate. There is that concern was not voiced in 2025. But in 2026, they came to the table saying, okay, well, what if we make it a little bit more reasonable? What if we say before sharing it or changing it, you have to try to reach out to that provider. But if they are unreachable, then you can change it to a more generic prescription or some other type of prescription, or take them off of their prescription. And medical health providers have to make that decision. And then there's all sorts of other stipulations in the law of and if that person, if it's a life-saving medication or if it's going to harm them if they take that medication, then the licensed professional, of course, should make the best medical decision for that individual first, and then still has to go through the process of trying to reach out to the provider. But yes, it makes it easier for them to provide the generic medication. As we know, the healthcare workers are hard to get a hold of sometimes, especially doctors. So they have to make a reasonable attempt, which the DOC in our rulemaking has said 2 times. They have to try twice, call twice. And if they don't respond, then you can switch them to generic or wherever, take them off of the medication, whatever the treatment plan, unless, of course, their health is at risk.
Thank you.
Yeah. Any other questions? Awesome.
Oh, Crystal?
Not a question, but first, Kelly, thank you. And thanks, Nikki. I think you were the one who prompted this topic last month. So I really appreciate that. And that Kelly was able to come share all of this so fresh on the heels of the session. When Kelly was talking about some of the bonding dollars, it made me realize that I'm not sure we've had conversation in this group about the really significant project that is about to be kicking off in Shakopee specifically. And I think some of the programmatic needs that are going to be met by that, and also some of the really big impacts on the facility that are going to happen over the span of 2 years as a result of how big of a project this is. So that's not a topic for today, but I wonder if that's something that, you know, I could potentially ask Carl Hunt to come talk about the design side of it. Jeff, I know you can think very well about how many adjustments are happening within the facility. So Vicki, is that something that you think would be a good topic for a month or a couple months from now?
I do, yeah. And who is Carl Hunt?
Carl Hunt is our Director of Capital Resources. So he's the person who is doing a lot of the work that Kelly was talking about when we're looking at studies for where would we potentially need to expand or contract, or what are specific needs that are not yet being met within our facilities. So he does a great job of talking about what that process is, and then how things like the Shakopee project are ultimately designed. And so I think he would probably be a great person to have join us.
Yeah, I think, you know, Shakopee is the only women's facility, so it's definitely relevant to this group to hear about it. And it's, there's going to be really major changes. These aren't like small, minuscule changes. So yeah, that's a great idea. Could you jot that down, Don? Okay, thank you.
Absolutely.
Yeah. Any other questions for Kelly? Or just comments? Thank you, Kelly, by the way. It's really comprehensive explanation of how things went in the session.
Yeah, thank you for having me. I appreciate it.
Yeah. Excellent. All right. I guess our next, Nikki, do you feel ready to talk about any conference planning or giving us an update? Nikki's here, right? Yeah, she is. Okay.
She was.
Yeah, she's here. I see her.
Okay.
Yeah, I mean, I see her name.
Hi guys, I lost my voice, so I'm
Oh,
sorry
no.
for how I sound, but I'm gonna keep this quick. We don't have anything to bring back to the group right now. We've met with RS Eden, our fiscal sponsor, so we understand how that works. So thanks for that, Vicki, that connect. We know how much is in the account. We know how to submit invoicing, all of that. So that was important for us to understand. And then we're meeting next week with Heather, the consultant, again, to kind of look at the menu and what some initial costs might be. We're also exploring, we reached out to Rivers Edge Convention Center in St. Cloud and have a quote as well. Right now, we wanted, I know as a group, we all wanted to do a Friday in April of 2027. As of right now, the only Friday available at the Rivers Edge Convention Center in April is Friday, April 2nd. So I did some outreach with, you know, someone at the DOC, someone from community, from MACAC, from the Community Corrections Act counties, and someone from MACPO to make sure that, you know, the Closing the Gap conference, the MACAC conference, that these kind of correction focused conferences, that nothing is happening on that date. As of right now, nothing is happening on Friday, April 2nd. But I know that, for example, the MACAC conference, like they're still in planning for it. And right now they're looking at March, right? So that's just we're trying to keep our kind of finger on making sure that we're not going to be in conflict with any of the big groups, the groups that we want to have present at the event. There's not a conflicting kind of responsibility. So Maya, I don't know if you want to share anything you've been working on, you know, like the theme and graphics for the theme, but otherwise I imagine next month we'll have more to share after this meeting with Heather, to be like, okay, here's what we're going to use our initial buckets of money for. Here's what we are looking to see if folks on the task force have skill set or interest in doing, so that we can, balance the costs with Heather between us, and only use Heather and her costs for really what we don't have capacity or skill sets to do. I hope that makes sense. I apologize for my voice. I'll turn it over to Maya if Maya wants to share anything about the work she's been doing.
Yeah, so I had to miss our last conference subcommittee meeting, so they haven't seen the like things that I've kind of mocked up. I have 3 different kind of image ideas. And I'm really focused on the idea of we wanted this conference to kind of talk about the whole story of these kids, these girls who are going through the system. So I have that kind of in the forefront of my mind, the idea of like story, and also the idea of like the whole picture. As I've created these images, or I don't know, not images so much, but ideas in terms of the aesthetics of our marketing that we want to use. And so I'm hoping when we meet next week that they're gonna look at what I came up with and see one that they think really meets our needs. And then it's really easy for me, once I have kind of an aesthetic, to just like pop out all additional marketing materials that we need. So
Thanks, Maya and Nikki. And Nikki, I hope your voice gets better soon. And yeah, thanks to everyone on the committee, the conference committee. I know how much work that involves to put together something like that. So, just a big kudos to all of you for contributing your time and your talent to that. Okay, any questions for the members, or I'm sorry, the conference committee at all? Great. So next on the agenda is the membership committee update. So I have been in email contact with Savannah, Tana, and Angela. I think Angela and Tana are both here. And we've had a chance to go through the 7 applications that were received for the various positions. And all of us identified 3 of the individuals as having experience or expertise that's relevant to the openings that we have. So the openings that we have that the task force is in charge of nominating people for are, one is advocacy for justice involved individuals, one is justice impacted experience, and the other is expertise in victimization. So by my understanding anyway, and I'm going to talk more with the membership team, there are 2 people that we've identified as fitting the advocacy and the justice impacted experience positions. We haven't decided which 2 of the 3 are going to fit those positions best. And I think that's kind of our next step. In my perspective, and I think most others share this perspective, we haven't identified someone who has expertise in victimization as of yet. I think we'd probably like to have maybe an individual that works with either, youth who've been victimized, or women who've been victimized, or just someone who works in that type of a position. So if you know someone who you think would be a good fit for that particular position, please encourage them to apply. You can either connect them with me or connect them with Dawn to help them, you know, get access to the portal where they make their application. I don't want to name names just yet because we're still kind of, we still haven't kind of landed on two. I have, but I don't feel like we've had a, you know, agree. I want to make sure that everyone is kind of on the same page about the best two to fit those two positions. So, but we do, I think we will have those positions filled soon. For those of you who may not be aware, Corey has stepped down from her position, or I guess to put it more accurately, she's chosen not to reapply to continue, but she has identified someone from the public defender's office who she thinks would be a good fit to kind of fill that role. If in fact that is a role, I still need to kind of figure out what role Corey was holding, like what we're, I'm assuming it was the public defender's office, but maybe it's something else. We'll work on that. No need to, this is recent, so no need to jump on that today, right this moment, but the membership committee will work on that.
We also have a number of people who are, their appointments are coming due this year.
Okay,
Between August 8th, August 8th is a big date when a lot of people got appointed. Between the end of July and the beginning of August, we have a number of people, 1, 2, 3.
shall we
I
name
counted
those
5.
individuals or
Yeah.
email them?
If you want, I can name
Yeah,
them, or
let's-
otherwise.
I know
can just
that
send an
I'm
email.
one.
Yep.
I'm one that I need to send an email to myself requesting
So, the people that I'm tracking are Tana,
Tana.
Tana, Jeff, and Vicky, and
Nikki.
Corey, and Nikki. Yep, that's what I've got.
All right, so Tana, Jeff, Nikki, and me. Assuming you want to stay on.
Now, there are, last month we talked about different processes for different
Mhm.
types of appointments and that kind of stuff.
Yes.
So
Yeah.
I believe you are a direct appointment.
Okay, so.
Yes, you are a direct appointment.
For me to do, okay.
And yeah, everyone else that I mentioned is a open appointment, so it's,
And you said they're supposed to email me, right?
they can email you, yes.
Just email me to indicate that you want to stay on, or if you don't, let me know that as well. So I guess it's just Tana and Nikki at this point. It can be brief and then I'll forward it to Don or you can CC Don actually would probably be
That
the
works.
easiest thing. And then we can continue your appointment, or if you choose not to reapply, I hope that's not the case. But if you choose not to reapply, then we can get that, you know, start filling that position too. Yeah, so we also have one opening, the MIAC opening, which
That
I
is a
think is a
direct
direct appointment, but have we identified someone?
We have been talking with.
We meaning
groups
you?
of it. Yes, yep, DOC, because it's a
Yeah.
DOC appointment.
Yeah,
Yeah.
so you have identified someone?
We have not identified a person, but we've been talking about how to
Okay.
get somebody in that
Okay.
seat.
Great. Any other direct appointments that we're still waiting on?
So,
No, okay, so those are the openings. Yeah. So I'll follow up. I saw as I was actually walking in the door that there were some emails from a couple of people on the membership committee, but I'll follow up with those later on today and we can kind of make some decisions and then maybe send out an email to the rest of the group. And well, I think the first thing we generally do, in the past at least, is email the person, make sure they're still interested, and make sure they understand when the meetings are, that they're going to be able to attend, et cetera. And then once they accept, then I'll send something out to the whole group. Well, first it goes to the
Yes.
commissioner,
Yes,
sorry.
you'll send it
Next
to
step, to you all.
Commissioner
Okay.
Schnell. We'll get it to him,
Yeah.
and then he will make the official appointment
Yeah.
using your recommendations.
Yeah, okay, yeah, there's the plan.
Yep.
Little convoluted, but hopefully everybody
Yeah.
understands.
Thank you to the membership committee for the work that you're doing. Really
Yeah.
appreciate it.
Great. All right, so any comments about membership or questions about membership?
Vicky, I have a question. This is Tana. Do we need to narrow those 3 people down to 2?
Only because I don't think we have someone that really fits the expertise in victimization.
Right.
We have people who've experienced it, which is one type of expertise, but I think we're really looking for someone whose work really kind of
Right,
revolves
right.
around that. So, but the other two, advocacy and justice and impacted experience, I think both of those, I think all 3 of them kind of to some degree meet those, but we need to figure out which 2 meet it best, I think.
Okay.
I think
Okay.
we've all kind of narrowed down to the same 3 people.
Okay, that makes sense. I just want to make sure I understood the next step.
Can you say more, Vicky? I'm sorry I missed that. Can you say more about, are we in need of someone who understands victimization and additional, can you say more about that?
So the way the when I say open appointment, that means the appointments or the positions on the task force that the task force kind of and our membership committee convenes to, look at all the applications. And we send recommendations to fill those positions to the commissioners. So that's what I mean by open appointment. And of those open appointments, we have certain types of expertise that are attached to each of those positions. And for those positions, the 3 we have are advocacy for justice impacted women and girls. That's one. Another for justice, a person that has justice impacted experience with the justice system, in other words, lived experience. And the third position is someone who has expertise in the area of victimization. So yes, the answer to your question is yes, and that's how it works. Does that make sense, Nikki?
And you're looking for someone with expertise, not lived experience.
Well, it could be both, but yeah, I mean,
Okay.
I think
I'd like to circulate. I can circulate
Yes.
information about that amongst my
please
networks.
do. Yeah,
Okay.
I think
Thank you.
your position actually I'm sure connects you to a lot of people in that area. So yeah, that would be great. Any other questions about the membership stuff? All right, well, thanks to Tana, Angela, and Savannah for helping with that, and we'll continue to confer with one another today and tomorrow probably until we figure out which 2 we're going with, okay? All right, public comment. We have 5 minutes assigned for public comment.
We do not have anybody online.
Okay, so I guess we can skip that. Yeah, I guess, any other thoughts or concerns or things that you would like to see added to the agenda, future agendas? Right, hearing none, then I guess I saw a
raise your hand?
movement.
Or maybe that was a wave goodbye. I'm not sure.
Okay. Probably. Was that Angela?
Yes, was it a wave goodbye, Angela?
No, actually it wasn't. One of the topics that I think would be helpful for us to discuss as a group at some point in the future is just some updates on what's happening in field services for justice involved women and girls. I know we've spent a lot of time working through policies and looking at some things related to facility-based interactions with justice involved women and girls, but the vast majority of them both youth and adults are on community supervision. And there are changes happening through the CSAC committees and lots of discussions around assessment and services. And I think there's a lot of topics that could come to this table for some discussion.
Angela, do you have an idea of who we might identify to best speak to that, including potentially yourself, since you work in that area?
Is Kaylee still on this group as well? Because I think
Kaylee Griffin? Which Kaylee? Sorry.
She's not.
No.
Okay, I don't remember her last name. She worked in youth probation though.
Okay. No, she is not, but I mean, she might be willing to come talk to us, even if she's not.
And Angela, I'm so glad that you said that. I think that's a great idea. Don and I both work very closely with the assistant commissioner who's over community services and supervision and has been integral to a lot of the changes that you're talking about as far as what's happening in the field services side around case planning and community supports. So I think we can talk to her, get some suggestions. Her name's Kelly Mitchell. And then I'm also going to be with all the district supervisors tomorrow at their meeting. So I can also sort of get this on their radar as a topic that's been requested, and we can figure out who would be the right people to come talk to the group about it.
Yeah. Yeah. Especially if there's someone who specifically focuses on women or youth or youth, that would be especially pertinent, I think.
I mean, I think you have a lot of topics rolled in there, right? And some of us in community supervision in our units, we have gender responsive caseloads. And so that supervision looks different. I mean, I think we're talking about a range of things, right? One of the things that decisions are being made on at CSAC are around assessment tools. And the assessment validation study came back that it is not, and I'm speaking about the LSCMI, the findings in the reports, that it is not a valid, strong tool for women, especially women of color. And so very strong conversations happening around the best trailer tools and what should be being used to help best assess justice-involved women and girls, because that's what's really driving community supervision and the services that women and girls receive when they're on community supervision. So I think you have these different pockets of topics, right? You're probably not going to get everything in one discussion because assessment and service looks different. Services to women and girls might look different. What is best practice in supervision for a variety of trauma-based services? I mean, there's just a variety of topics that could be discussed. And so what topic you want to talk about at a particular meeting probably will drive who the best speakers or visitors to come and talk about it might be.
Yeah, and I think since there's such a mix of different types of professions on the task force, it might be important if we're going to have that conversation to explain what assessment even is, what its purpose is, and why instruments like the LSCMI are not really appropriate for women. And I mean, I think it's been argued too that even the trailers are not great, that the WRNA is really a better option. But anyway, I think just understanding even that piece for lots of you probably already know what those are, but I think a lot of people probably don't. Too.
That's what I was going to ask. And I just will completely echo and validate your comment in the chat. I think a couple weeks ago when I heard about the official assessment that the validation that Angela was talking about, I was like, okay, so what are we going to do about it? Right? Like, what are we going to do? We have it right here in front of us. What do we need to do now? So do you think it would be useful to start with like the bigger picture conversation and which I think maybe it would be Assistant Commissioner Mitchell would be well positioned to talk about the overall work that's happening in the community supervision space, what has come back with the LSCMI, what is being explored as a result of the most recent findings that we have. And then I think maybe from that conversation, be able to identify the more specific conversations to go from there. Because I imagine there's a really broad range of understanding, like you were just saying, Vicki, within this group. And maybe it would be good to just start with like where we are now.
Like an overview.
Yeah.
Yeah. What do you think, Angela?
I think that's a great place to start. I think it will spark a lot of good conversation and probably some really good questions from the task force and kind of shape what those conversations look like moving forward, what topics people would like to know more about, where there's some advocacy needs, because I think there definitely are those needs in these different pockets.
Yep. Well, thanks for bringing that up. Any other thoughts about potential future agenda items? All right, hearing none, I guess our meeting is adjourned, and I hope all of you are having a really nice summer and continue to. That's good. That's a great idea.
It is.
I
I'm super glad.